Hi, my name is Laurel, and I'm so excited today to be talking to a nutritionist who's here to talk about supporting positive mental health through nutritional therapy. Her name's Sara Russell, and she's based in Italy, but we have somehow managed to bridge the time gap and find a chance to talk. So thank you so much for being here, Sara.
Thank you so much, Laurel, for being in conversation with me and for opening up this really great cross-pollinating conversation about nutritional therapy and emotional therapy.
I think that, collaboration between a psychotherapist and a nutritional therapist wouldn't be the first thing that people would think of, but I actually think it's really important. I was saying earlier that we can't just go to 1 hour of therapy a week and expect it to change our life. There has to be a more holistic approach to creating positive change in your life towards improving your mental health. And I really believe that nutrition can be a cornerstone of that positive change. So I'm really glad that you're here to talk about it because I'm actually not qualified to give nutritional advice to my clients. That's way outside of my scope of expertise and practice. And it's so wonderful to have, a mental health informed and aware nutritionist to talk to. So I would love to hear just kind of whatever introduction you have to when you work with people around mental health and kind of how the nutritional therapy supports that. What does it look like?
Yeah, sure. I feel exactly the same way about emotional therapy in the sense that nutrition and emotional work are so interconnected and they feed off each other in such incredibly helpful ways. There's an incredible synergy between the two areas where good emotional health and good nutritional status reinforce and enrich each other in kind of a positive snowball effect. So very, very powerful. I love for people who come to me for nutritional therapy, especially if they have any kind of emotional struggles, temporary or kind of longer term, for them to be working with somebody who is specifically supporting their emotional health. I cannot see just good nutrition as a substitute for emotional therapy. I personally am of the conviction that almost everybody should have a therapist. Just, you have a dentist, you have a mechanic, you should have a therapist. And, don't wait to break down. Just like you don't want to wait to go see your dentist for your teeth to break down. You definitely don't want your emotional health to break down before you find a therapist. So I love to work with people who have emotional health needs, who are being supported by a good therapist for their emotional health. And I also refer people a lot, even people who don't even think that they have emotional issues. It's like, oh gosh, we all do. And you need a good therapist. So that is kind of the first thing I wanted to say, is that they really enrich each other mutually. And the second thing is, eating is something that most of us do several times a day, 3 times a day. Most people are eating every day, and it is such an incredible opportunity to nourish our bodies, not just with nutrients, but with positive emotion around eating. And if you are eating in a shared context, some people today are in the struggle of living alone. And not having the shared meal context. But even if whether or not you are alone, you are in relationship, either with yourself or with others, or both.
Food is often very social. And I frequently see people that have one of my specialties is working with people that have anxiety specifically around food, and it is often paired, almost always paired, with a social anxiety around food, because food is so often enjoyed in community.
Yeah, absolutely. And additionally, eating and nourishing your body can help you be more vibrant and more
Yes.
able to connect with other people.
Mm-hmm.
Because food symbolically is very much about, it takes us back primarily to the first relationship that we had, which was to our mom. And the first way that most of our mothers or whoever, took over for a biological mother, even if it was with a bottle, the first act of love that we receive as human beings is nourishment.
Yeah.
Through the milk.
And there's so much attachment in that. It's not just about nourishing the body. You think about what emotional needs are met when, a little baby is being held and nourished. It's also the social aspect of, oh, when I cry, my need is met. I'm responded to, I'm cared for, I'm safe. And so
Yes,
that is very deep primal experience that we have there.
it is. Yes. When we eat socially, it's really nice for there to be kind of this implicit shared message of you matter and I care being shared among the different people eating together. And, of course, I think that's important in all interactions that we have. Even with ourselves, I think this is a dyadic relationship that most of us should have with ourselves. We shouldn't just be looking to outside people. Of course, our first relationship with eating and with nurturing as human beings is the care that we received from our mothers when we were so vulnerable and absolutely needy. And now as we grow, we become more and more independent and autonomous and more able to give.
We have to feed ourselves.
Yes, absolutely. So really nourishing and nurturance are etymologically and symbolically and on all levels inextricable from each other.
Yeah, they really are. The more you talk about it, that I'm more just like, absolutely, of course. I mean, no wonder there's emotional eating. No wonder there's anxiety around food. No wonder people have such, strong memories and emotions tied to specific foods, because it's wired into us from day one. Yeah. So when someone comes to you, if they're struggling with a mental health issue or even just, kind of garden variety, transitional, mood fluctuations, what are some of the kind of pitfalls that you see or the most common things that are needing some alteration or guidance from you?
Well, the biggest things that I see kind of on a macro level is the person eating enough? Is the person eating in a way that is conducive to good digestion and absorption of nutrients? So important. You could be eating the best foods, but if you're eating on the run, eating in your car while you're in traffic and talking on your phone and trying to multitask, then you're not going to digest and absorb your food as efficiently because your nervous system is in a state of alarm and fight or flight. You can't digest and assimilate very well that way. And you're not going to feel
or enjoy as
exactly.
well.
So and then the other piece is is your body digesting and assimilating? Even if you are eating a good variety of nourishing foods, sitting down for your meals, taking a deep breath, relaxing, if you have some kind of a physical health issue like Crohn's disease that is unmanaged, that is preventing you, in spite of all your best efforts, from absorbing your nutrients.
There are autoimmune issues, which we have an epidemic of autoimmune issues right now that do affect your experience with food, whether it's a rise in allergies or other kind of digestive issues. They're becoming more prevalent, and it really does alter your relationship with food.
It really does, and there can be an increased need for nutrients.
Yes.
Due to, whatever type of chemical imbalances. I sometimes see people who have an increased need for vitamin B6 and magnesium, for example, and it can make a world of difference in
Mm.
people's anxiety, or, even people who need more zinc, or more, just to balance their omega-3 and omega-6 fatty acids in a particular way.
Yeah.
Um, Sometimes just that tweaking can make a huge, huge difference
Mm.
to a person's entire mental functioning.
Mm-hmm. Yeah. You mentioned something about people not eating enough, and I'm really curious about that because, as an American, there's this caricature of Americans as being overfed, as eating, all this, fast food, very rich foods, not nutrient dense, but certainly calorically dense. And it's fascinating to me that one of the first things you said was that if someone's not eating enough, and I would love to hear you speak about that.
Yeah, well, there are different types of not eating enough.
Yeah.
One of them could be, the I'm, I'm feeding myself with lots and lots of calories, but
Mm-hmm.
very little variety and
Mm.
very little nutrient density. So, there is this phenomenon of being, stuffed to the brim with food, but really lacking in nutrients.
Mm-hmm.
That is one form of it. And then the other form of it can be a spin-off of a fear of being in that first place, which is, what if I get fat? So you overcorrect by not eating often enough, not eating enough food, and not eating enough of a variety of foods and nutrients.
Yeah. Which absolutely will affect your mental health. I mean, if you're on a calorically restricted diet, you are not going to feel good. It's your body is having to use its reserves, which you will feel fatigued, you will feel sluggish, you will, as toxins are released, you will feel bad.
Oh, yeah.
Yeah. Yeah.
And unfortunately, there's a vicious cycle where if you're restricting your calories and nutrients, your body will go into starvation mode, and your thyroid gland will lower your basal metabolism, and you will actually likely gain more weight on less calories versus, achieving the objective of being fit and efficient metabolically.
Yeah. Yeah.
Yeah, you don't
Which
want
can
to
be
put your
very
body.
frustrating.
Yeah,
Yeah.
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 You
Okay.
don't. You definitely don't want to put your body in an alarm state connected with fear of starvation. That can
Yeah.
epigenetically really reprogram the system
Oh.
to do things that you don't necessarily want
Yeah.
metabolically and mentally.
Yeah. Yeah. And I feel like we're kind of veering towards talking about weight loss, which is a totally different topic that I'm certainly not qualified to speak on. I'm sure that you are, but I'm more interested in the mental health aspect here. I think the other direction we were kind of going is that kind of that survival state, that fear, panic state. And I think that a lot of people are in it right now because we are, here in America, we are, many of us 2 months into a shelter in place. I know that you've been in Italy sheltered in place for longer. And when we are in that survival state, protecting ourselves, protecting our loved ones, just, getting our basic needs met is how the majority of our energy is spent. Um, I have seen a lot, certainly with, my loved ones and my clients, that anxiety around food specifically is really, really spiking. And I'm wondering if you can speak to that a little bit, about kind of what happens when we go into that panic state and what happens when we get very anxious about food. How does that affect the body, and how does that affect our choices around food and nutrients?
Sure. Yeah. So it's such a great question and such a big question as
Yeah.
well.
I think that
Yeah.
was 5 questions.
Yeah. I definitely think that people are going in different directions right now, and that depending on our context, where we live, what kind of setting we are in, and what kinds of networks we have around us,
Mm-hmm.
our context and our possibilities may be very, very different. So for example, somebody living in the country, a lot of people, here in the Tuscan countryside, a lot of us have started like, hunkering down at home. Oh, this is a perfect time to start a garden, and I'm going to, plant all these trees and all these, all these berries and all this stuff. So a lot of people are burgeoning right now with their food production.
There's kind of
So
an abundance mindset
yeah,
of like, now I have the time, I'm going to cultivate and nurture the land, and in doing so myself.
yes.
Mm.
So some people are able to have this adaptive response. So for example, in my family, we were on the one hand a little bit compressed because the school has kind of disappeared and we have less structure, but we already had chickens and ducks,
Mm.
and we currently have ducklings that are going to be hatching in a
Mm.
couple of weeks. We have some young baby chicks.
Mm-hmm.
um, we have, it's just like everything's growing. We built a kiwi pergola and just planted a whole bunch of stuff, and things are, even other people around us have been very dedicated to just growing things
Mm.
and producing more of their own food, not necessarily from a place of anxiety, but from a place of ease
And abundance, yeah.
and abundance.
Mm-hmm.
I have more time to go pick the herbs that grow wild in my area, and our cherries just ripen on the tree, and it's just, your rhythms can be different. If you live in an urban environment, I realize this is like, there is not the same potential to do this in an expansive way. So there can, if you live in a food desert in particular, it can be very hard. You might feel very anxious about, where's my next, what is my next trip to the grocery store going to look like?
Yeah. And will they have this thing that I so
Yeah,
badly want to nurture myself? Will they have my favorite food? Will they have, the staples that we need to just be able to cook? Tons of
yeah.
anxiety there. So the scarcity anxiety is very real right now.
Oh, absolutely.
Yeah.
Even, access to fresh foods,
Mm-hmm.
um, balancing, your need for fresh foods with foods that have a longer shelf life. What if I
Mm-hmm.
get sick? What if somebody in my household gets sick?
Yeah.
What if I can't go to the store for a long time?
Yes. Yeah.
These are all
And
very,
anxiety around going to the store in general, even if, you are not in a food desert and you yourself are healthy, it's going to the grocery store can feel like um, one of the most kind of dystopian experiences that we have on a semi-regular basis right now, because there is such real hypervigilance. I'm just feeling this level of hypervigilance in people that are shopping, trying to get in and get out, get what they need and get out with as little contact as possible, which is what we should be doing. But also the hypervigilance that comes with it is very taxing on the body.
absolutely,
Yeah.
yes. I think a lot of people are really bringing out the best in themselves too in all of this, even though they may be feeling anxious. There's a lot of just consciousness and respect
Mm-hmm.
for other people. A lot of people tell me, I'm just so aware of, okay, don't just think about what you're going to get. Don't touch anything unless you're sure you're going to keep it.
Mm-hmm.
Just so I really want people to acknowledge the work that they're doing to respect themselves, their families, and others,
Yeah.
because it's huge. And I have a niece who works at a Walmart, and it really makes a difference. The
Mm.
level of respect and even gratitude that people have toward, as shoppers, towards people who are essential workers in grocery stores um, and other stores that are currently open.
Mm-hmm.
It makes a huge difference. Just smile, thank, and be respectful as much as you possibly can.
Yeah, absolutely. And that really can ease the anxiety to be tapped into that. Okay, yeah, we're having a definitely varied but collective experience here. And the things that I'm shopping for may not be the things you're shopping for, and you may be shopping for someone who's immunocompromised, and I may be shopping for an elderly neighbor or whatever it may be, but we are all just trying to get our shopping done, so let's be as conscientious as possible.
Yeah,
Mm-hmm.
yeah,
Yeah.
absolutely.
Yeah. One of the things that I specialize in is working with food anxiety, people that, either, most often have a genuine reason to be anxious around food, whether it's a gut condition or an autoimmune issue, or a genuine allergy, an anaphylactic allergy to a food, or they've had a traumatic incident like choking on some food, or some other trauma related to food where they genuinely don't feel safe around it. So I've been working with that, that set of issues for a while, and I'm seeing it really shift during COVID. Either they have less anxiety because there's no pressure to eat in restaurants, and they have total control over their food now, and there can be more intentionality around the way they nourish their body because they're not eating in the car the way they used to. They're not just kind of, cobbling together some calories to keep themselves going. And then on the other hand, I'm seeing people that are highly anxious, that they're, not sure, is it safe to order takeout? Is it safe to have someone else prepare my food? What if I don't know where this food came from? Can I eat this? And I'm wondering what you would say to someone struggling with that anxiety that is really heightened by COVID right now.
Well, first of all, if you're feeling anxiety at this point in time, or at any other point in time, definitely reach out to a therapist who is specialized in anxiety and experience, ideally also with food anxiety, such as yourself. So that's the first thing, really giving yourself the space to,
and compassion.
Yes.
The compassion.
The space, the time, the compassion, and just the resources to deal with this issue as it is, without judgment. It's so easy to tell yourself, "Oh, snap out of it." It's because for a lot of us, that's what we've heard. Even people with genuine issues, like I have a few anaphylactic allergic reactions that they have actually decreased over time doing specific types of work. So I have been able to retrain my immune system in many ways, which is incredibly exciting and empowering.
Yeah.
And there are some things that I haven't been able to shift, like, a peanut and a wheat allergy. They're just there. That's okay. I'm okay with it.
But you can learn to work with them, not necessarily to eliminate them, but you can learn to work with them in a way where you don't have crippling anxiety around, oh my God, what if this, cookie has a tiny bit of a nut in it? You're like, well, I think I'm just going to pass on the cookie, or I'm going to take that risk. And it's a personal choice, but you can learn to not have it control your relationship with food.
Yes. And, I feel really fortunate because even though I have had these, these allergic struggles in the course of my lifetime, I've never had heightened anxiety associated with those reactions. So I feel like that has helped me keep things low grade. My anxiety has come more from other people's reactions, like saying, "Oh, you're not really allergic to that food." And I'm like,
being
not
dismissed.
So, just like, random relatives or, so that is a really interesting dynamic. Sometimes the problem is the relationships of other people around a healthy relationship that you have with food and your knowledge of your body and how it interacts with food. So that it's a lot, different people have different types of scenarios. I also work with a lot of people who have a lot of fear, and justifiably so, around reactions that they have, but sometimes because it's hard to pinpoint what's causing what, like in yourself or in a child, especially, when you have a small child who isn't yet able to really articulate because of their developmental stage, or because of their verbal development, or, a disabled child who is not able to emotionally and verbally express their reactions. So you have to kind of try to figure out based on what they ate and what you see.
That's very hard.
It's very hard.
I also see a lot of people that struggle to identify what's causing their symptoms because the symptoms may not arise until the food gets to a certain point in their digestive tract. And they're like, well, what did I eat 14 hours ago? And that can be really hard. You have to be really meticulous in your tracking. And it can be confusing. It can be anxiety provoking. It can be discouraging. But you don't have to go through it alone. There are, you know, highly trained, you know, really qualified nutritionists that will work through that with you. And Sara is one of them.
Oh,
So,
thank you.
yeah.
Yes, and I really think that even just helping people with the right tools at the right time is incredibly empowering. Tracking, if you do it at the wrong time or in the wrong way, can increase anxiety. And if you do it with the right type of structure and the right type of timing and support, it can be incredibly empowering and it can reduce anxiety. So it's not just, oh, you know, here's a tool. There's a context and there's a person and there's a timing, and all those things have to kind of go together in order for the tool to be helpful.
Yeah. And support and resources, that you're not just there, you know, trying to figure it out on your own.
Yeah. Yeah. You know, just even supporting people and seeing how reassuring it can be for them, to have feedback from another person, and to have a structure that is individualized for them with feedback and advice, because you're not going to find exactly what you need, you know, in something that is
in a
written
vacuum.
for. Yeah,
And this
exactly.
really goes back to, you know, what we started with, that, you know, any journey towards health, whether it's physical or emotional, it needs to be holistic. It cannot just be you try one thing. I see so many people that they decide they want to take an antidepressant, so they do, and then it doesn't work. Well, okay, did they also do therapy? Did they also look at their diet? Did they look at you know, there are so many things that can be part of a comprehensive care plan. Mindfulness, meditation, exercise is a huge one that I see people kind of just, well, it's too much work, but it can have a really profound effect, a positive effect on mental health, as well as, I imagine, digestion and absorption. If you move your body and your systems are kind of just running on a better timeline, or have more energy, or you're able to absorb nutrients better.
Absolutely.
Yeah.
You know, a lot of the time people need they need an interdisciplinary approach to their healing.
Absolutely.
Physical therapy, emotional therapy, nutritional therapy, occupational therapy, educational therapy, whatever it might be. You know, sometimes people need at least 2, sometimes 3 or 4 types of therapies.
The more resources, the more efforts that go into uplifting you and resourcing you, the more successful you will be.
Yeah. Don't oversaturate yourself.
No. And you don't have to do it all at once. In fact, you shouldn't, because then you won't know what had the biggest impact, right? But yeah, you don't want to completely overhaul. We're not going to like Marie Kondo your life. You know, you just do things gradually. But, you know, not expecting one thing to be the magic bullet. There is no magic bullet. There is, you know, a set of therapies and support systems out there, and figuring out what cocktail of support systems works best for you. That's the work. And there are plenty of people that want to support you in that.
Absolutely. And, you know, even to go back to a detail that you mentioned earlier, medication, you know, sometimes people are all over the map. So there are people who are like, just give me a pill. And there are other people who are on the complete opposite end of the spectrum. It's anything but medication. You know what? Sometimes I have worked with people, and part of the work is just really helping them overcome a bias against medication. And I can't even tell you how many people have thanked me, have written me and said, thank you, you know, because I maybe worked with them as parents of a teenager who was in emotional distress. And they say, you know, thank you, you know, because you didn't just help me with the nutritional therapy, you helped me overcome this terrible fear I had that somehow my child would be endangered by taking medication. I feel like that actually saved their life. And it does sometimes. You know?
Absolutely. I have seen some medications have no effect because they likely weren't being supported with other complementary therapies. And then I've also seen medications have a profound effect when other supportive therapies were not doing enough on their own.
Yeah.
So it can really run the gamut. And I too do a lot of work around, deconstructing the stigmas around medication. It's not the only way, but it's not something that everyone should rule out either.
Oh yeah,
Yeah.
I completely agree. If you're
Mm-hmm.
doing all the things and you're
Mm-hmm.
not getting to where you should be with, you're putting in all this effort.
Yeah.
Sometimes there really is a medication that can help you bridge that gap and
Yes.
just
Mm-hmm.
get things connected.
Yeah.
And thank goodness it's there, right?
I've seen medication really serve to kind of be just like the enough of a boost so that you can actually do the rest of the work. Because if you are profoundly depressed or you are so anxious that you're paralyzed, you're not going to be able to pursue all the complementary therapies that you deserve to be able to access, because all your energy is just going into being depressed or into your body, like the physiological response to anxiety. So I've seen it just be that enough of a boost that then you can go on to do the rest of the work. It's not a substitute, but it is it's a game changer sometimes.
Yeah.
Yeah.
Yeah, it really can be. And
Yeah.
we live in an interesting era where there are a lot of people pronouncing opinions without necessarily
Mm-hmm.
even knowing what they're talking about.
Right. Yeah.
You know, don't form your opinion about what type of support you should or shouldn't receive based on influencers, because
Mm-hmm.
they're
Yeah.
not really the best experts to
Yeah.
rely on.
Yeah. Or advertisements. I mean, in
Yeah.
America, we have this weird thing where medications are advertised to the public rather than just to doctors who actually have the training to make a judgment call about what would be a good fit for a client. So
Yeah.
anyway, we could keep talking for hours about mental health and nutrition and supportive therapies and what holistic care really is. But I know that you are, starting your day and I'm ending mine here. Thank you so much for taking time to chat with me. And if people want to reach out to you to work with you, how can they get in touch?
Well, I can be found on my website, buildnurturerestore.com.
Okay.
And I basically, through my website, you can send me an email and subscribe to my newsletter, whatever you want to do. And
Okay.
yeah, I offer a complimentary 30-minute discovery call, just to help people feel comfortable with whether I'm a good match for them, or if I'm not, I will do my utmost to refer the person to somebody who is. I think
Yeah.
that's really important. So,
Is there a particular population you love working with, or do you love variety?
I love variety. That being said, the two kind of overarching specialties I have in my practice are people with complex health cases.
Mm-hmm.
Complicated health journeys. I love stories. I love people's histories, and I love listening.
Mm-hmm.
And I know not a lot of practitioners really like the deep individualized listening work and putting pieces together, and that's what I'm really good at.
Mm.
The other area that I've worked with extensively and really love is the reproductive years.
Mm.
So preconception, fertility, and postpartum health. They
Okay.
can be such a time of increased anxiety in food and nourishment, because we have
Yes.
so much pressure, right?
Yeah. Well, let's have another chat about that another time. Okay.
Definitely.
Okay. That sounds fascinating. All right.
Uh,
Great. And as I said, I'm a therapist and I specialize in working with anxiety and trauma, including food anxiety and food trauma. And my website is laureltherapy.net. I have a few openings right now. I really love working with motivated young professionals and working with the issues that I specified. I'm also trained in EMDR, which is a trauma treatment that's been proven to be really effective. And I also offer a free 15-20 minute consultation to make sure we're a good fit, because your relationship with your therapist is too important to have a just okay fit. You deserve a really good fit. So we've got to make sure that happens. Thank you so much for being here, Sara. And I look forward to continuing to chat in the future.
Definitely. Thank you so much, Laurel. It's
Yeah,
been really talking.
you too. Thanks.
Thanks.
Bye.
Bye.